Moving on from formula and breastfeeding, there are a lot of things that can go wrong during the development of a new baby. Some of these things can be random, some genetic, and some preventable. Drug exposure is one of the most common things that can cause issues during development, and the exact effects can be variable depending on dose, timing, and frequency. Perhaps one of the most well-documented and most devastating exposures is alcohol exposure, which can have serious effects on developing newborns, especially earlier in the pregnancy when the brain and nervous system are developing. This can lead to fetal alcohol syndrome, which can have lifelong negative effects on mood regulation, cognitive function, including memory and attention, growth, and it leads to distinct facial characteristics. There is no known safe amount of alcohol during pregnancy. Exposure to methamphetamine in utero, meaning while in the uterus, is associated with a low birth weight, preterm birth, cognitive impairments in problem-solving skills, short-term memory, language development, and issues with inhibition and attention, in addition to withdrawal symptoms at birth. For the record, there is no known safe amount of methamphetamine for anyone at any time. Opioids are another common prenatal exposure we see, and opioid exposure is associated with higher rates of preterm birth, neonatal death, and growth restrictions. As they grow, these children have also been shown to have cognitive, language, and motor delays, with increased risk of attention disorders and behavioral problems. We commonly see these children withdrawing after birth, and have to care for them while they recover, which is very sad. For mothers that are on prescribed opioid therapy, like methadone, Suboxone, or Subutex, it is recommended to continue therapy under medical supervision despite these risks, as the risks and outcomes are far worse for children being exposed to street opioids without medical supervision. Another common prenatal drug exposure we see is cocaine, which is also associated with growth problems, preterm birth, microcephaly, meaning small head size, and other serious congenital brain, eye, limb, and sex organ abnormalities. Cocaine constricts blood vessels, which is part of the mechanism behind some of these serious developmental concerns, and it can also lead to brain bleeds and serious cognitive deficits. Cocaine use is also notoriously a risk factor for placental abruption, which is an emergency for both the mother and baby as the placenta can detach and lead to serious blood loss. Probably the most common prenatal drug exposure we see is marijuana exposure, or THC. Like all the other drugs, except for prescribed opioid maintenance therapy, it is strongly recommended to not use marijuana while pregnant. Marijuana exposure is associated with low birth weight, smaller head size, preterm birth, and differences in brain development. Exposure is associated with attention problems, social problems, higher rates of intellectual disability, and possibly even autism spectrum disorder. Some of this data is still more mixed as these studies are somewhat newer, but again, there is no known safe amount of cannabis use during pregnancy. THC can also be spread through breast milk, and the recommendation is absolutely to stop using marijuana while pregnant or breastfeeding. However, if a mother still plans on using marijuana anyway, this is still not considered a reason not to breastfeed, as although there are risks associated with this exposure that the mother should be educated about, the benefits of breastfeeding are considered to likely outweigh the harms of not breastfeeding, at least for the time being. Infections while pregnant can also cause serious developmental problems. A common acronym we use to remember the main ones is TORCH, or torch infections. The T is for Toxoplasma gondii, which causes toxoplasmosis. This can cause developmental problems with the eyes, calcifications in the brain, swelling of the head, liver, and spleen, and seizures. One of the common ways this is spread is through cat feces, which is why you may have heard that pregnant women should never change kitty litter. Fun fact. The O in torch infections stands for other, which can include chickenpox, which causes intellectual and neurological disabilities and seizures, parvovirus, which can cause hydrops fetalis, which is a serious swelling disease, Zika, which can cause seizures, developmental delays and death, and HIV, which can lead to AIDS, just to name a few. The R in torch stands for rubella, which is a vaccine-preventable disease that can cause permanent hearing loss, visual impairment, and intellectual disease. The C in torch stands for cytomegalovirus, which is one of the most common causes of hearing loss in newborns, although it can also cause visual impairment and other cognitive deficits too. The H in TORCH stands for herpes simplex, which causes brain disease and death in up to 70% of cases if untreated. This is by no means a comprehensive list, but it's at least a good place to start.